Oh, yes, that's very common. And in trauma, what you often have is fragmented memories. It's kept in I always just say the oldest part of the brain as well, where it's very emotional. So you remember a lot of sort of feelings and vivid pictures as well. But it's often like fragmented. And this is why the writing can really help, 'cause it starts to organize it and it helps your brain to process it. But there are things you can do to help if you suddenly feel overwhelmed. Again, quite normal. And one is to acknowledge it. So you can write, say, the hardest part of this is, or another good question to ask yourself is what I keep avoiding is, because often what happens in trauma is people don't want to go there as well. So this is where the writing is quite good, because the idea is you do write about everything. Okay, so if you're noticing you're not writing, it could be just one of those trauma blocks. You want to avoid it. Okay, so remind yourself what I keep avoiding is ... One of my favorites, because it's to do with compassion focused therapy, which I'm very fond of, is if I were kind to myself about this, I'd say ... Okay. So having that, just understanding this is hard, understanding trauma is difficult, understanding trauma is messy. It is not a clear cut step by step. It's a messy experience, and that's okay as well. Or another good one I like is to actually say to yourself, one small thing I can do next is, and again, I'm very, very encouraging of actually doing the small steps. Because sometimes if the step is too big, this is often what happens, I find in therapy, that it feels overwhelming, you can't do it, it's just too big. But just do a little small step, like a 1%. Yeah, I can do that. That's absolutely fine.